Hi everyone, welcome to my channel. Please, if you are yet to subscribe, don't forget to subscribe and join the journey. It's a journey we are gonna rock together. Okay, so this morning I'm gonna be talking about medical prefaces, roots and surfaces, but in this channel I'm gonna focus more on on medical prefaces. So medical terms are very important, and they are most known for nursing students. So medical terminologies, these are the words that we use in healthcare settings. We use it for anatomy, we use it for diagnosis, we use it for treatment, we use it for procedures. It's a term we use basically for everything we do in healthcare field generally. So it is a must known. And medical prefaces, these are the words that appears at the beginning of medical terms. So example of that is like A for alpha, A for apple, Nigeria style. Okay, so A in medical terms simply means without. Example of that is asymptomatic, meaning without no symptoms. What I mean by that is if I walk up to you now as a nurse and let me clarify that nurses don't diagnose. So if I walk up to you as a nurse, I'm only citing an example now, and I told you that I'm having cold, right? And of course, there are certain signs and symptoms that accompany cold. And as a nurse, you didn't see none of that sign. This patient is asymptomatic, meaning she's without no symptoms. So that is for A. I can also say for every other person listening to me, medical terminologies, if I know we've all done syllables like banana. You know how we break those words down, and at the end of the day, when we combine them, we have a meaningful meaning. The same thing is applicable to what I am currently doing now, and it's applicable to medical terms and also applied in medical field. So in order to understand, we have to know certain medical terms. So let's keep going. The next one I'll talk about is AB. AB means away from. If you stretch your hand away from your body, it's called abduction, away from the body midline or the body trunk. That is abduction. Let me clarify that. I will try to keep this medical prefaces in an alphabetical order. I'm not going to touch all, but I'll make sure I touch the most commonly used ones. So let's move to the next one, which is ACR. ACR means extreme or extremities. Example of that is acrocyanosis. Acrocyanosis means we use this term mostly in when we do ABGA score. When we get to pediatrics, I will explain what ABGA score is used for, because it's a most known for pediatrics. So let's keep rolling. Acrocyanosis means this patient is born with a bluish discoloration to extremities due to poor oxygen circulation to that part of their body. So that's for acro. The next one is adduction. Remember I mentioned abduction, the one with the B. The one with the B is when you move your body away from your body midline or your body trunk. The one with the D, which is adduction, this is the one that you move towards. Adduction means towards. So you're moving towards the body trunk, excuse me. You're moving towards the body trunk or the body midline. So let's move to the next one. Another commonly known one for A is like anterior. Ante means in front, right? Anterior, like antecubital, if you want to describe the front of your elbow part. So antecubital. The next one I'll talk about is anti, because it's also commonly known. Like example of that, if we say antibiotics, anti means against. So you are given medication that actually work against that particular bacteria. So another one is auto. Auto means to serve, like autoimmune disease. If a patient, that means your own body is attacking itself. Example of that is type 1 diabetes. When I get to diseases, because I'm going to be explaining those diseases in a layman term, but when we get there, I will explain better what is the cause of that and what I mean by autoimmune disease. So the last but not the least is, I always have issue pronouncing this, so don't, is like arthritis, like arthritis. So arthritis, from the word arthritis, that is the pain, that uh, painful joints. When you have a problem with your joint, like you have pain, you know, with your joint. So that is all for A. Now, let's move to B. Uh, for B, I'm gonna start with brady because it's a commonly used term. So brady, like bradycardia, means slow. Brady means slow. Cardia means heart. When I get to see, I'll combine it once again and explain it better. So the next one is bio, like life, biology as an example. So BI also is a very good example. BI means to, want to, BI. So now let's move to the C. Let's move to C. In C, we talk about cardiac. If you're saying a cardiologist, you're saying a doctor, right? So now let's combine brady plus cardia. Brady cardia means this patient have slow heart rate, lesser than 60 beats per minute in an adult. That's how you describe your patient with heart rate, bradycardia. So we're on C. Another one is cepha, your head. If you see cephalic region, if you see hepatitis encephalopathy, any word with the cepha, CELPHA, think of your head, cepha. All these I know might sound like, what is she talking about? But for people in nursing field and medical field, you have to know all of this. These are must known. Your anatomy, your medical terminologies, they are really, really, really important. So let's keep going. Another one for C is circum, like circumduction. Circum means round, okay? Round. Okay, let me see which other common ones I'm missing for C. For preface now. Okay, let's move to D now. So D, I love D. D for dog, D, whenever, why I like D? Because it can easily be remembered. If I want to describe something that is not working properly, I can say this thing is dysfunctioning. So in your medical terms, whenever you see a word that starts with D's, like DYS, you start suspecting that this thing is not, is not in the right place. Example of that is dysphagia. Dysphagia in medical terms means this patient have difficulty swallowing. Dysphagia, difficulties swallowing. Another one is derm, like our skin. If you're seeing a dermatologist, you're seeing a skin doctor. So another D, let me see which other common D I've not mentioned. For D, derm, dysfunction, die, yeah. So all right, so that's all for the D. Now let's move to E. In E we have erythrocyte, like erythro means red, erythrocyte means red blood cell. We have epi is above, we have encepha, I think I mentioned that. That is the brain region. Remember, cepha is the head, encepha, that's the brain. What am I missing for E? Echo, like echocardiogram. Echocardiogram is also a common term used for E. Okay, another example is endo. Endo means within, like endoscopy. Another example is EU, which is if you are happy. Example is inferior. EU means good, like whatever you're describing, medical terms, and it begins with EU. You can start kind of feeling happy because with EU you're trying to describe that, okay, this thing is in a good shape. So I'll stop here for this video. I try to cover from A to E in this video. Like I said, it's much more than this, and please stay tuned. Don't give up on me yet. You're still gonna find these videos interesting when we get to those diseases. It's just, you know, I had a request to make some of these medical prefaces from one of my girl, and I try to touch like the common